Hello, everyone. We're just giving folks time to get in the room, but we are going to start almost right away, just because we have a couple of speakers, but I also want to make sure that I give every opportunity to folks who are wanting to share resources and updates about their organization today. So we will more than likely skip the introductions for the team at large. If you would like to, go ahead, feel free to even put your contact information in the chat for folks. I'm going to put a couple of resources in the chat for folks that I'll discuss a little later during our announcements section. So as folks are joining, um, myself and then my colleague from the Alliance, as well as our co-facilitator, will introduce ourselves. I'm Vanya Howard. I'm the Field Experience Apprenticeship Coordinator with Minnesota CHW Alliance, and I facilitate the Supervisor Roundtable, as well as provide apprenticeship support for our CHW apprenticeships, as well as those who are students and are working towards apprenticeship or working right. And then I'm also a birth doula. So I support births maybe about 2 to 3 per month, um, and provide prenatal health education to our birthing persons, as well as postpartum support for folks who have delivered with me. I will hand it over to Shandy to introduce herself.
Good afternoon, everyone. My name is Shandy Potismangra, and I am the Workforce Development Coordinator with the Minnesota Community Health Worker Alliance. I am helping and assisting Vani with helping to get organizations prepared for CHW employment and potentially be part of the apprenticeship program. And I will hand it back over to Vani.
Keisha, would you like to introduce yourself as well, please?
Yes. Good afternoon, ladies and gentlemen, if there are any gentlemen. My name is Keisha Hayslett. I am the RN instructor and CHW instructor, and I'm gracing your presence from Excellence Health Career Center, where we are a workforce, public health, global training center. And so I also facilitate the group, and I'm excited to be here amongst greats.
Hi, see you guys in June.
Thank you so much. And to all of the attendees, if you're not speaking, please push mute just to avoid some feedback during the meeting. Thank you so much. So I'll start right away with our announcements from the Alliance. We have been doing a lot of work. Most of you may have received an email about a kickoff meeting that we did last week for the MDH Sustainable, CHW Sustainable Plan. We are forming work groups. One of the resources that I put in the chat is for folks to be able to choose a work group that they would like to be a part of. So we encourage you to do that. Meetings will start in April. And once we've confirmed all participants for the respective work groups, we'll be sending out dates for those meetings with greater detail. So that's the first announcement. The other announcement I wanted to let folks know about is the CHW Leadership Institute. Registration is open for community health workers right now. We encourage community health workers to be a part of that leadership group, whether or not they are new to the profession or existing in the profession. The leadership program really is a space for CHWs to learn and grow. It's serves as a diverse space for cohorts of training, provides leadership training for CHWs, knowledge and skill capacity building for them, as well as opportunities to engage with other CHWs in learning and skill building activities. We also assist and support CHWs to practice and advance into leadership positions, and then again for them to connect with other CHWs across multiple sectors. So applications for that are being taken right now. If you have community health workers in your organization, please pass that opportunity along to them. The first class will be starting in April as well for that, and it is set to be virtual at this point. Another announcement that I'd like to make is that the Alliance has submitted an application to the Minnesota Department of Labor and Industry to provide sponsorship through a model of apprenticeship that we would support the training mechanisms for that component, and employers are able to on board as what they call signatory employers. So more to come about that. We're waiting for approval on that process, and I'll be sharing information either by email or during the next supervisor roundtable. There's also a survey in the March newsletter that we sent out maybe a couple weeks ago that provides opportunities for employers to speak to their interest in becoming a signatory employer. And so if you wanted to do that or are interested in learning more, setting up a meeting with myself or Shandy, please see our newsletter for that link for the survey. And I'll open it up for others. If you could just push your raise hand icon, I can open it up for others to share announcements and resources from their organization as well. At the end of the meeting, sometime today or tomorrow, I'll also send a follow-up email with any information that was shared in the chat so that folks who might miss this segment of the meeting can access those links through the email as well. So please share links if you don't want to personally share here. I'm happy to forward that to those who are attending, as well as to those who are not. So if you have a resource to share, go ahead and either take yourself off of mute or raise your hand, and I can just kind of keep up with that. And that could be resources or announcements from your organization, any resources that are outside of your organization that you think the folks here would like to hear about. We welcome all of that here. Okay, since we don't have anybody, we can make some introductions then. I was going to skip that, but since we don't have anyone sharing resources, definitely feel free to take yourself off mute. We can take some time for introductions.
Hello, my name is Peggy Moore. I am from North Point Health and Wellness. I just jumped on. So when you were talking about announcements, I'm like, oh, North Point actually is kicking off the heart health event that's going to take place in April. It's a 5-session group. And it's Black and Indigenous women that have heart disease, heart attack, heart failure, any of those things. We have put together a curriculum around different topics to help them understand and be educated in how to prevent from having other events. So we just finished up our flyer, and so I can actually make sure I put that out in the chat.
Thank you, Peggy, and welcome. Anyone else have an announcement or would like to introduce themselves and their organization? Our theme today is going to be related to rural health resources and information about a CHW program that is up and coming in the rural area. And so if you have anything to contribute to that topic, we'd like to hear from you as well. We'll spend a couple minutes here before we begin to introduce our speakers. I see that there are folks putting resources in the chat, so we'll make sure to collect those. Again, I've put 2 resources that I talked about in there too, so feel free to get that information from any of us who have shared from the chat. And then once again, I'll also include that in a follow-up email. No introductions today? We can see all of your names, but would love to put a face with some of the names that are on here. No pressure though.
I am always one to plug my stuff. So I'm grateful for the opportunity. My name's Kathy Gomez. I am with the Minnesota Coalition for Family Home Visiting. So in a similar vein, there are many community health workers doing home visiting and programs who work with home visitors. And I think one thing we have coming up that might be of interest to you all is we are hosting a quarterly meeting next Thursday, and we're going to be doing some legislative updates as well as really talking about promising practices and how to address mental health with young children in families. So I'll put the link in the chat, and thank you for the platform to share.
Thank you, Katya. Good to see you again.
I can jump in just to introduce. This is my first time, I think, coming to this group. I've been part of been part of it and a trained CHW, but I'm Paula Wojcicki, director of the Whitney Senior Center, and we're in St. Cloud. So we have part-time, one full-time and 5 or more part-time community health workers, but our focus has always been around the older adults and seniors in our community and delivering evidence-based classes and health coaching. So.
Thank you, Paula. Good to see you as well.
I could jump in. My name is John Fick, and I'm the network director overseeing the creation of a CHW hub in the northwestern Minnesota area, centered in Bemidji. I work for Sanford, and Sanford is a grantee for a network development grant and for building a CHW hub. Very pleased to meet everybody, and yeah, for those of you in our area, would love to hear from you. I'll put my contact info in the chat. Thank you.
Thank you, John.
I can go next. I'm actually with Sanford as well, but down in the southwest corner of the state in Worthington. We have one CHW in our primary care clinic, and then on the hunt for another one to help support our work we had gotten a perinatal and infant health innovations grant through Minnesota Department of Health. And so we really want to place a CHW in our OB women's clinic. So working on that as well.
Nice. That's great to hear. Great to see you too again, Christine.
I can jump in, Vanya. Good afternoon, everybody. My name is Tara Nelson, and I am the program manager for the Healthcare Access and Education team down here in Southeast Minnesota, serving the Rochester, Casson, Austin, Albert Lee area. We currently have 16 community health workers. We partner with Mayo Clinic. Our CHWs are based out of our community-based organization, Intercultural Mutual Assistance Association, or IMAA. It's nice to see everybody.
Nice to see you too, Tara.
I can introduce myself. My name is Dr. Murugi Mutiga, and I work for Washington County. I've been working there 3 years now, creating their first community engagement program. And I have 4 community health workers in my team doing this work. And we work across 2 departments, public health and also community services. So they do a lot of work. So they do the events and meetings and all that, but they also do one-on-one caseloads, helping people with different, they come in all ways, but it seems like one of the main ones now is helping people apply for health insurance or add people to insurance and all that. And then I have a part-time job too, where I teach community health workers at Normandale Community College. So I guess I have them on both sides. So, and I've been doing that for over 10 years. Thank you.
Thank you, Murugi. Good to see you.
Mm-hmm.
Hello, this is Miriam Goodson, and I'm with Alliance of Chicanos, Hispanics, and Latin Americans, and I am based in Rochester. My our organization is in the hopes of creating the pathway to develop the community health workers' career. And we've been working in this path for about a year. Hopefully, we'll have people more in the certification for helping the Hispanic Latino community in the Rochester area. And also, we work through different projects. So depends what kind of needs are in the community. We are mainly educational. So thank you.
Thank you. Good to see you. And for those who have just joined us, we're just taking a few more minutes for introductions, but resource sharing as well. I myself and others here have shared resources that are in the chat. Please go ahead and review that. We'll try to make sure that we capture all of that information and send it in a follow-up email for those who missed that in the moment. But we have a couple more minutes before we introduce our speaker if folks want to share a resource or introduce themselves briefly.
My name is Sia Bean. I'm a registered nurse by profession. Just have some interest in what the community health workers do. At this moment, I volunteer at the shelters to do health screening and refer the homeless people that don't have any medical access. We educate them about their health, how to take their medications, and just guide them within the system. And so I contacted Vani and them, and just want to be part of what you guys do, and I love it. So thank you for having me.
Thank you for joining, Sia. Good to see you again.
Good to see you too.
Well, if there are no other introductions, we can go ahead and introduce our speakers. Keisha?
Okay. So first up, we have, say this name correctly. Wait a minute, where did I do it? Hold on one second. Don't move. Hold on. It's coming. It's coming. I had it queued up and it disappeared. Oh, here it is. Okay. So our first speaker is from rural Minnesota, home delivered meals. Janelle, is it Janelle Peterson? Am I correct saying that correctly? All right. Welcome, Janelle. The floor is yours.
Thank you. You did perfectly on that. Vanya, do you want me to share my screen or do you want to share yours? How best would it work for you all?
You can share yours if you would like,
Okay.
but we have it queued up. Either way, it's fine for us.
Okay. Can everybody see that? Can everybody see my screen, the slide presentation? Okay, awesome. Yep. So thank you so much. It is a pleasure to talk to you all today and just provide you some information on Homestyle Direct. We are a national provider of home delivered meals. And I cover the state of Minnesota. I have lived in Minnesota all but 4 years of my life. So born and raised in rural Minnesota, the daughter of a dairy farmer. So I understand rural Minnesota, I think, relatively well, even though now I live in Minneapolis. At Homestyle Direct, make sure my slides are going here. There we go. Okay. Our mission, and this is a big slide, and I am not going to go through all this, but if I put it into one sentence, our mission is to help eliminate food insecurity while maintaining health equity across the state of Minnesota. So we want to make sure that folks get a nutritious and delicious home delivered meal that helps them with their health disease management, but also with their food insecurity. In Minnesota, we are covered by the 5 Medicaid waivers at this point in time. And I say that because part of my work is working with the different health plans to get us in for Medicare Advantage, and then also working with the area agencies on aging to see if we can become a provider under Title III funding. But what I will tell you is that no discussion is off the table. So if you have an idea that's outside the box for me, let me know. Let's talk about it. Let's look at logistics and let's see what's possible. One of the best parts of my job is that I was told we never say no, we investigate and see what we can do. Our menu, which I'll go in a little bit more detail in a couple slides, has 35 plus dietitian approved meal options. We have a corporate dietitian who curates our menu, listening to member feedback, et cetera, to make the menus what they are. As I said, we have medically tailored meals, and we'll go into even more detail with that, but we really want to appeal to the different health and disease management situations that come across for people across Minnesota. And then we are member centric. And I will say that I have sat with our customer service team and our new member onboarding team a couple of times over the last 6 months. I started in September in this role, and I am just amazed and also in awe of everything they do to meet our members where they're at. Right now, and since I've started, we have a 99% customer service rating, approval rating from our members. Our meals are at a 95% rating, and our overall satisfaction is 98%. So I am very proud to work for an organization that receives such great feedback from our members. When they do customer new member onboarding, they really take the time to find out what the member needs as far as how much freezer space they have, any disabilities they might have, so that they can make sure they're meeting them where they're at and providing a service that works for them. So we have some new things coming. We used to cycle our menu 3 times a year. However, member feedback, which I told you was important, they told us they'd like us to refresh it just twice a year and then make substantial changes. So our spring menu will roll out April 1st. And in that menu, we have made 12 changes in menu items. And then in the fall, it'll be 15 to 20. So we'll be refreshing in April and October of each year. There will be a minimum of 35 menu options, but we will also during that cycle offer seasonal specials. And those specials will be based on the season, based on member preferences. If we've heard from a number of members, we would like you to try this meal option, our dietitian will put something together. We'll try it. We'll see how it goes over. And then it may be considered to put on the menu for the fall option. So there'll be 5 to 6 specials, and they'll be rotating through. They will be online, and then our customer service will talk to folks who call in to place orders, or we call them to make sure they know about them too. So in essence, they could have up to 42 different options to choose from at any one time. The other thing is we add a supplement to the first shipment of each month for the member, and that is meant to make sure that we're meeting the Older Americans Act for nutrition provisions. And so we used to do a power drink mix. Again, we heard from our members, we would like you to bring back the power oats. So the question I've gotten, what does power oats mean? Basically, you think of it as an oats with extra vitamins and minerals and some extra protein. And we have a new recipe booklet that goes with that power oats, so they can use it as a breakfast meal. They can use it to make bars, cookies, etc., and have it as snacks throughout the day. So in essence, we're helping them to meet their needs. And then besides the meal they get, they could also have oats for breakfast in the morning. I'm going to stop there for a moment. Are there any questions on what I've presented so far before I go into more detail about medically tailored meals? So like I talked about, we have a dietitian who looks at all of our meals to make sure that we're meeting the medical tailoring according to different organizations. And I'll tell you each of those as we go through. And also she looks to make sure they appeal to diverse palates and dietary needs. And then one of the big things is our members choose every meal they consume. So we're not just choosing them for them and sending a variety box. They are actually choosing the meals they consume. So on our spring menu, we have 25 heart healthy meals, and they follow the American Heart Association guidelines. We have 34 diabetic friendly meals. So if you were thinking about the previous slide, there's only one meal on our menu that is not diabetic friendly. And again, it follows the National Diabetes Association guidelines. And then we have 24 of what we call power packs. Now, these are a minimum of 600 calories and 25 grams of protein. And I think they're meant, in my dietitian mind, I think of them for folks who may have some cerebral palsy, or they might have Parkinson's, or they might have tremors from some other chronic disease or illness. And so they need more calories. So this would be the meals for them. And then we have 27 renal friendly. So again, following the National Kidney Foundation guidelines, and March is National Kidney Month along with National Nutrition Month. So we want to really make sure, and I will tell you that I have tried I think I tried all but 2 of the items on our fall menu. And I also incorporated my husband, my mother-in-law, my youngest son, who's 23, to taste them also, and got really great feedback. And I would eat any one of the meals for a daily meal. So I wouldn't tell you they're great if I hadn't tried them. And now I'm leaping into trying the new meals on the spring menu. And then we have 7 gluten restricted. So when we say gluten restricted, they're wheat free, but we can't say they're gluten free because of where we prepare them. So we can't be 100% confident. So we want to put that in there. But what has happened is we used to only have 2 or 3 gluten restricted meal items, and now we have 7, and that will continue to expand because we've heard from members they would like more of that. And then I'm just going to briefly go through this part. So starting a referral in Minnesota. So the referrals can come from case managers, from nurses, from primary physicians, from social workers, dietitians, public health nurses. I mean, there's a broad range. And, anyone can make the recommendation to someone they're working with, saying, you know what, I think this might be a good option for you, or what do you think about this? And then it's seeing who would be that person that would make the referral. And I'm more than happy to talk further about that if you have any questions. And then we have a referral form they can either fill out online. So on our website, we have where they can just refer online and set up an account as a case manager or a referral source, or the referral can be sent in to data entry at homestyledirect.com. And then this is where they would refer a member, and then they can set up an account under this case manager tab. The other thing I wanted to point out is our members can order their meals online, and down in the bottom is this little blue icon, and it has a little person with their arms out. And that is an icon that helps people who need certain adjustments to their screen, either for low vision, if they have a seizure disorder, et cetera. There's a variety of things that can help make that menu or that screen more hospitable to them and help them out so that they can place their orders themselves. And we have a number of folks who want to be independent and place their meals orders. And then once we get the referral, just so you kind of an idea of our process, our new member onboarding team, once it's been verified that they're eligible, they will call them. And like I said, spend 30 to 45 minutes going through all the particulars. If they can't get a hold of them, they'll send a text message to their cell phone and then also send an email to them, letting them know we just want to get in touch with them to make sure that they can place their order and get what they want. If after 3 times we have not heard from them, we send them a starter kit. So this would be the one time where they wouldn't choose their meals, but we just don't want to keep delaying it. And we want to make sure we get them started. So they'll send a 10-meal variety pack. And I will tell you that 99% of the time that gets the member to call us and say, hey, I don't really like this meal, but I want to order my own. And so, but we just want to make sure they get some meals to get started. So we're not delaying it beyond that time. Let's see. And then another advantage, especially for rural Minnesota, is that we deliver via FedEx. So we can essentially deliver anywhere in the state. And we deliver as far north as you can go in Minnesota, as far as south, east, and west. We let the member know the week of the month when they receive their meals. And in Minnesota, it's week 2 and week 4. And then we ask them to set up with FedEx Delivery Manager so that they know exactly the day and time that delivery is going to be coming to them. If someone is not wanting to do that on their phone, but they have a family member who wants to do it or somebody else, they can definitely allow that person to do it and then they can help them out. And it's really nice if people have dialysis appointments or doctor's appointments so that they know and they can kind of work around that. And then we do have, you'll see the handles on the box that came out last September, October. And has been a huge hit with our members so that they can maneuver those boxes much easier. And then we do have small, medium, and large boxes. So small, just for your benefit, are about 10 to 12 meals. Medium is 14 to 16, and then large is 32. And we ask them about freezer space, what that looks like, how many they can handle at one time. The meals come frozen. And then when it's getting time to prepare them, we recommend that folks put them in the refrigerator 2 to 3 days ahead of time of eating them so that they're semi-thawed and therefore it reduces the amount of time it takes for them to get heated up. They can reheat them in the microwave, the oven, or the air fryer. So microwave is not required for reheating. If they have a toaster oven with an air fryer in it, that works well. Otherwise, they can do it in their conventional oven also. So that is what I had. What questions do you all have? What kind of thoughts are you having? I'm just going to stop sharing that if you don't mind, and then I can get back and see the whole screen. Any comments, thoughts, or questions for me on that?
Janelle, CHWs can be a referral source as well, right?
Yes.
Don't necessarily have to be working alongside a social worker to be able to do that, right?
They can refer, and then if we needed something further, we would contact the case manager. So we would just probably ask for that. But yeah, they could refer and then just let us know if there's a case manager or someone else that would refer. But yeah. Or someone else that you want us to refer to. But if you have the ability, if the CHWs have an ability to ask for an authorization, et cetera, they can do the whole referral process. Otherwise, they can refer and then just let us know, like if you know what kind of waiver they have, let us know that, and then we can follow up with that. Yeah.
Perfect. Thank you.
And I let people know I'm the contact for Minnesota, so I cover all of Minnesota. So versus people trying to figure out who to call, just email me or call me or text me, and I am more than happy to find out what your, I know how to answer your question and get back to you. And that way, I know you all have thousands of things on your plate. So let me be that intermediary and take that off your plate if you don't mind. Yeah. And if you ever want to try them, I'm all about people trying our food. I think I had a week where I offered that and I sent out 12 boxes of samples. I didn't personally, but my colleagues did. And people loved them. And so it's been really nice to have people be able to experience that. So please let me know if you'd like to try them. Be more than happy to send some out.
Janelle, would you mind putting that last slide up just with your contact information? I just wanted to snip that out of there.
You betcha. You
Awesome.
betcha. Sorry about that. I took that off kind of early, didn't I?
That's okay.
It's a great resource for folks out in rural Minnesota. I know as a home visiting CHW, I lots of people connect with delivered home meals. So this is great.
And I will say, if you have anybody else that you think, wow, Janelle, you should really talk to them, because I will tell you, full transparency, that I was taking some notes when people introducing themselves and thinking I should really connect with them, because one of my goals for myself, since I worked in the hospital area for a long time, is just working with different health systems to let them know for the seniors that they have that where there is a resource, and we just want to be a resource to help them out if needed. Anything else you can think of? I really appreciate the time. Thank you, Vani. And I just thank you all for the wonderful work that you do. It is so amazing. And with the healthcare background, I just appreciate it so much, because I know it's very important to the people who you work with and who you help.
Thank you for joining us, Janelle. If there's nothing else for Janelle, I just want to remind folks that we will share her presentation in a follow-up email at some point over the next week or so. So you'll have that information as well.
Thank you so much. Have a wonderful day.
You as well.
All righty. And we're ready for the next speaker. She hopped off. You know, one thing that stood out for me was, I know it's so small, but the functionality of the box, like the handles on the box, that's thinking, like, not so much the food, but it's like, oh, she got handles on the box, like pockets on your dress, right? Okay, so our next presenter is from Thrifty Way Pharmacy, and her name is Samantha. Wait a minute, let me say this right now. Samantha, is it Ketterling?
Yes. Yep.
I said it right.
Got it.
Welcome. The floor is yours. Thank you.
Thank you. I have got a co-presenter with me, Cassie Doyle, and she's going to kick us off to get started.
Perfect. Thank you.
All right, nothing like navigating the screen here. Let's see. All right, I think I got the wrong screen. All right. What?
We got your Word document, Cassie. There we go.
All right, I get it figured out.
Yep.
All right. Technically challenged when you're working in a different platform than you're used to. So appreciate your patience there. Well, good afternoon, everyone. It's a pleasure to be here today, and I thank the Alliance Group for allowing us to present. My name is Cassie Doyle, and I am the Vice President of Clinical and Business Transformation for Thrifty White. And my role within our organization is expanding our services in our pharmacies to better support our patients and our communities. And I'm just really excited to present today on this integration of pharmacy technicians and community health workers. This innovative approach really aims to enhance healthcare delivery and improve overall population health. And so very excited to be here. And Sam, I'll pass it over to you right now just to introduce yourself before I go to the next slide.
Sounds great. Thank you, Cassie. Good afternoon, everyone. As Cassie said, we're really honored to be here to talk with you all about a new role within the pharmacy of integrating a pharmacy technician as a community health worker in our pharmacies. I serve as our Director of Pharmacy and Clinical Operations. I am a pharmacist by training and background and have had opportunity to work in both Minnesota and North Dakota, both rural and more urban pharmacies. My role at Thrifty White is really to oversee the traditional pharmacy practices on, what you would traditionally think a pharmacy does in dispensing prescriptions, And then also that integration, as Cassie mentioned, clinical services that we're expanding into our community pharmacies. So I work very closely with our pharmacists and technicians that are providing direct patient care, and just really excited to discuss this opportunity. Thank you.
All right. Well, before I jump into the pharmacy technician and community health worker role, I wanted to provide just a little bit of background on Thrifty White Pharmacy. We were founded in 1884 by Mr. and Mrs. White in North Dakota. So we're 141 years old. Both of those individuals that started the first pharmacy were pharmacists, and Mrs. White was actually the first female pharmacist. White Drug was actually acquired by Thrifty Drug Stores in 1985 in Minnesota, and continued to serve the upper Midwest. And now we've expanded across 6 states. We have about 100 pharmacies, primarily serving rural communities. And our mission as an organization is to empower healthier lives through personalized and accessible healthcare. And today at Thrifty White, we really go beyond just filling prescriptions, serving rural communities. Everybody in the community is wearing multiple hats. And so we have a really strong, dedicated focus around value-based care, which is really enabled by a lot of our proprietary technology solutions that we have as an organization. And we have a lot of appointment-based adherence models that we offer our patients, and really they're the pillars to our foundation with our patient engagement and clinical service delivery. Our medication synchronization program focuses on getting patients to get all their medications filled at the same time each month. And really that seeks to address the issue of, the unknown snowstorm in Minnesota, where you can't make it in to get your medication, coordination with the doctor's office of, getting refills ahead of time, prior authorizations approved, and that way when the patient is due to pick up their medication at the pharmacy, it's ready to go, and we know each month, every time, what day they're going to be coming in. Over the years, we've done, multiple research studies showing, the benefits of patients being here to their medication and avoiding delays in their therapy. With our appointment-based model, it really allows for multiple touch points with our patients to enable, our entire pharmacy team members to have, prioritized conversations with patients. We know when they're going to come in, when they're due for a flu shot, and also work with them on any challenges that we're seeing, in their medication profile as, we're dispensing for them. As I mentioned, our investments in our technology, we have a proprietary clinical management system called Patientricity. We have a dedicated central fill site in pharmacy that fills about 60% of our company's medication and ships those medications to our stores each day. And really that's to allow our pharmacy teams to have, the time to spend with patients, the right environment, training and development. And we really believe that, our commitment to our communities is our patients and our employee owners is really what makes us special. I myself grew up in a 1,000-person town in the northeast corner of North Dakota, about 15 miles away from Minnesota. So I'm not a Minnesota native, but I felt really lucky to have a Thrifty White Pharmacy in my community growing up. And my experience as a pharmacy technician and growing up in a rural community brings a really strong sense of purpose for a vision of this dual community health worker and pharmacy technician role. I personally know the impact on what a role like this can have on the community, from population health, care coordination, health education, and just honestly a escalated career path for pharmacy technicians and the pharmacy profession. So the pharmacy industry is changing. Over the past 20 years, pharmacists have continued to expand their scope of practice beyond dispensing just medications and doing additional services such as medication therapy management, where they're looking at all of their different medications, finding any duplication of therapy, looking for side effects, and doing a lot more clinically related interventions with patients beyond just dispensing the prescription. Also, pharmacies have continued to evolve, providing a lot more immunizations that they've done in the past, point of care testing. And really, the value of those expanded services were really highlighted during the COVID-19 pandemic. During the COVID-19 pandemic, it was noted that nearly 70% of the COVID vaccines were provided by pharmacies. By 2050, it's expected that the world population is projected to increase to about 10 billion people, with the number of individuals 60 years and older to triple. So by 2030, the U.S. is projecting facing a shortage of 125,000 physicians, which could affect the care of more than 60% of individuals with 2 or more chronic disease states. In addition to that, life expectancy in the United States continues to increase. And so that's, providing more meaningful care from physicians. And as the older population increases, pharmacists are available to offset this deficit by providing, those additional services, whether it be point of care testing, preventative care, and in some states, pharmacists are even able to prescribe. Really, community pharmacy, it's the front door to healthcare. In most of our communities, our pharmacists are the most accessible healthcare provider in the community. It's approximately 90% of Americans live within 5 miles of a pharmacy. And really, the pandemic, heightened that the conventional pharmacy system to kind of manually fill prescription model is a thing of the past. And there's a really large opportunity in the larger healthcare ecosystem for pharmacy to be more engaged. The demand for clinical pharmacists is more prevalent than ever. And since the introduction of medication therapy management and immunization programs in the early 2000s, it really paved the way for the current pharmacy clinical pharmacist model. And pharmacists have been ready to, accept and expand that role. According to the CDC, nearly 38 million influenza vaccines were administered by 57,000 pharmacies in the United States during the 2023-2024 influenza season. And in addition to vaccines, community pharmacists are also completed more than 2 million medication therapy management claims than previous years. 60% of Medicare beneficiaries are on a performance-based pharmacy payment model, which really relies on the engagement of a pharmacist through medication therapy management to improve their quality measures. And this is needed for, clinical engagement, kind of amplifying the value of impact that pharmacists can have, on the healthcare system. Recent changes in several state legislation also reflect the need for more clinically oriented pharmacists. 55 bills expanded the capability of pharmacists were passed and signed into law in 32 states in 2023, supporting the efforts to allow pharmacists to assist with, future shortages of the physicians, as I mentioned. Featured in some of the passage of bills is the ability of pharmacists to provide HIV pre-exposure and services for sexually transmitted diseases, as well as contraceptive prescribing, broad-spectrum antibiotic prescribing with physician collaboration, and expanded payment for pharmacist services and provider status. And it's projected over the next, 10 to 20 years that community pharmacies are expected to drastically change the way that pharmacists operate day to day. And not only will the clinical dispensing roles, increase, but the relationships between patients and pharmacists will continue to grow. To support the expansion of pharmacist authority and responsibility, we understand that the workplace must evolve to assist pharmacists and pharmacy teams with these changing duties, with an emphasis on the pharmacy technician. And I give all that background on the pharmacist just to kind of, help understand that the pharmacist role is evolving, and we see a large opportunity for our technician role to evolve and lead into this dual role of a community health worker and pharmacy technician. While the innovation and the role expansion is really bright for the pharmacy profession, it's also worth mentioning, the economic pressures facing the pharmacy. On November 13th of 2024, right here in Minnesota, the Star Tribune reported that CVS had closed 600 U.S. pharmacies between 2021 and 2023, and expected that they'll close 300 more by the end of 2024. Walgreens announced in 2024 that they'll close 1,200 stores, starting with 500 of them in the year of 2025. And over the past 2 decades in the state of Minnesota, independent pharmacies went from 478 pharmacies down to only 156. And large chains in the state went down from 550 down to 451. Leaving many patients and many communities without a pharmacy. And these closures, come from the economic pressures on the prescription reimbursement side. And at Thrifty White, we understand the need that we need to continually innovate to support our communities, but we're also not immune to the economic pressures of finding alternative payment models to continue to support the pharmacy practice and service the communities that we operate in. This dual role with community health workers and pharmacy technicians has been proven in other states, and we have really good relationships with colleagues in the industry. In Missouri, a research study was conducted by George Washington University to understand the community health worker field. And the results of the study provided research on, how to grow and sustain community health workers in Missouri. And that's actually what their research paper was titled. In the research, they found that some community pharmacies are cross-training pharmacy techs as community health workers. And they found that in 2019 to 2020, they did a pilot program where the community health workers were embedded into a rural pharmacy in southeast Missouri. And the goal was to improve chronic disease management. The community health workers screen patients for needs related to food, health insurance, housing, physical and mental health, among, a handful of other issues. The community health worker and the pharmacy staff met with patients and conducted home visits to coordinate healthcare service, such as linking them to medication programs and also referring them to a variety of social services that the pharmacy wasn't able to support. In that particular research study, HRSA, piloted and funded a kind of subset of that research with a pharmacy in rural southeastern Missouri in 2020. And in that research study that they done, pharmacists and pharmacy technicians were cross-trained to help patients manage their blood pressure through patient education and behavior counseling. The pilot demonstrated an improvement in hypertension control and also patients' confidence in managing blood pressure. In 2021, the success of these pilot programs led to actually the development of community health worker curriculum tailored to just pharmacy technicians. And this curriculum was made possible through a grant from the Missouri Department of Health and Human Services. And it was also developed in coordination with the Pharmacy Association, the participating pharmacy in the pilot, and also a vendor, which is called CE Impact, that coordinated the training and certification of the program. It, in the end, got endorsed by the Missouri Department of Health and Human Services, and they launched the curriculum in 2022 to allow technicians to be trained and credentialed as community health workers. Nearly 100 pharmacy technicians, had been credentialed through that training program as of February of 2023. And already by June of 2023, they had over 200 individuals that were enrolled in that program. At Thrifty White Pharmacy, we currently in the state of Minnesota employ 300 pharmacy technicians and feel like we have a really large opportunity to fill an unmet gap in our rural communities. Also specifically noted in the Missouri study, the program was driven by interest of pharmacy technicians wanting to do more, which I think, not only validates, what we see internally as a career path for our technicians, but that in Missouri, they were the driver of this program. All of the pharmacy personnel actually completed the training to assist in identifying and screening patients for social needs through an assessment tool. With all of the pharmacy personnel getting trained, including delivery drivers, it presented a really large opportunity to work with each individual patient that was being serviced in the pharmacy. Once the screening was completed, they were able to pass that engagement over to the certified community health worker. The pilot study reported over 1,400 delivery home assessments, 200 community health referrals, and an estimated out-of-pocket savings of $87,000 in prescription savings. Sam, next I'll turn it over to you to kind of go through some of the roles within the pharmacy and maybe tie in how we see our technician and community health worker role expand.
Yeah, sounds great. Thanks, Cassie. All right, so we thought we'd start with just kind of walking through the care team that exists within the community pharmacy in particular, and what their current roles are, and how we're continuing to expand that, specifically with this integration with the community health worker. So starting as a pharmacist, they're seen as a healthcare professional who traditionally specializes, in the preparation, dispensing, and appropriate use of medications. And their primary responsibilities include reviewing and verifying prescriptions, ensuring that the medications are safe and effective at improving their health conditions. And a big part of their role in doing so is providing education and counseling services to patients out in the community. So this might include counseling them on their specific regimen they're on, potential side effects or drug interactions that they might have, and adherence strategies. And as Cassie mentioned earlier on in the presentation, there is, a change in, different needs within communities. And so leading to a change in what type of role our pharmacy teams are having. And so pharmacists are kind of shifting from this traditional pharmacy dispensing role, as I mentioned, preparing and dispensing prescriptions, to being more involved in clinical pharmacy, where they're working directly with other healthcare members, such as providers, physicians, nurses, in various settings, hospitals, clinics, and other healthcare facilities, and really serving as an additional care team member to assess, any of their health needs, monitoring different therapeutic outcomes. They might be working under collaborative practice agreement where they can initiate or change therapy to help, meet therapeutic outcomes. And, they do this in various ways. They might be conducting medication reviews. They might perform different health screenings. And as I mentioned, either initiating or modifying therapy. And, really seeing the pharmacist as a, essential member of the care team in both inpatient and ambulatory settings. and the impact that they can have on, promoting, safe medication use and also improving health outcomes. Looking at the pharmacy technician role specifically, the pharmacy technician is a vital member of the pharmacy team in particular, both in traditional pharmacy practice and in more of the expansive services that our teams are being trained in. Pharmacy technicians' role in the traditional pharmacy practice is really assisting the pharmacist in preparing and dispensing prescriptions. This might include that they're managing the prescription orders that are coming in from clinics and hospital systems. They're verifying the accuracy of prescriptions. They might be compounding medications. They're ensuring appropriate label for patients, ensuring that the patient's needs are met through that. They are also handling some of the various functional processes within the pharmacy that I think is important to mention, such as maintaining pharmacy inventory, including restocking of medications and supplies. And they also help ensure compliance with various regulatory standards. But most importantly, they are really the first person in the pharmacy that our patients are talking with. And so they see kind of the frontline questions or needs that our patients have. It might be that, they are seeing the high copays that they might have from dispensing their prescriptions. Or they might see, a patient's inability to pay a copay at the point of sale system. They might see kind of from those, functional processes, different drug shortages that are going to impact patients or the rising cost of medications. Really they kind of have both an inward and outward view of, different needs that patients have that might not be recognized within the health system unless you see the patient out in an ambulatory setting. And so overall, there is just such a large opportunity for technicians to assist further through the identification of different barriers that patients might have. I'll also note that in kind of expanded roles within the pharmacy technicians are also trained in providing immunizations and different specialty pharmacy opportunities where they might be, high risk conditions that they're treating, such as, patients with HIV or autoimmune diseases that might require additional coordination of care. And so, as you all are very familiar with the community health worker role, we feel that there, is an opportunity to bridge between a pharmacy technician and a community health worker to address these unmet needs in the communities, and really helping, use maybe the technical and pharmacy experience along with the relationships that patients have with our pharmacy technicians in the community, along with the community health workers' role in being able to coordinate care, knowing resources, identifying different access to services. All right, Cassie, if you want to advance the slide there. All right, so walking through kind of the impact that we believe that this role can have is hoping to build a sustainable future for pharmacy technicians and the pharmacy practice. I think Cassie did a good job kind of outlining, the need for community pharmacies, often being one of the only healthcare providers in the community. And so kind of building, the future of that practice along with the people that work within the pharmacy, such as our pharmacy technicians. We can promote further career growth and diversification of their role. And by leveraging existing relationships with our patients, we have that trust already built. And now just needing, additional training and experience and resources to further connect patients to any of their needs. And some of these ways might include providing health education topics with patients with chronic diseases, for example, diabetic patients, and ensuring they know how to use their glucometer, or hypertension patients and knowing how to take their blood pressure. We also may, be identifying different health and environmental disparities, and help facilitate those connections between resources, such as the presentation earlier on innate food insecurity. And then, looking for opportunities to help complete health-related screenings, and those referrals that are available. Cassie, next slide. All right, so where we're at in this process, we have started kind of a multi-pronged approach on building this role. First, we have one of our already trained Minnesota technicians enrolled in a CHW course. They started at the beginning of this year with Minnesota West Community and Technical College in Worthington, and excited to be finishing up their first course here. We also, the second prong approach is having a already trained CHW join our team and cross-train as a technician. And so we currently have 5 openings across Minnesota, Detroit Lakes, Thief River Falls, Montevideo, Wells, and Baudette. And we're continuing to have, defining and making modifications to our roles, such as the job description and policies and procedures, to integrate this role into our organization. And then lastly, continuing to identify potential funding opportunities to help with the sustainability of this role and really the pilot and getting started. All right, next slide. All right, so to help summarize the impact we're looking to make through this, I think it's good to go back to the why. And I know Cassie had some good information on, different states that have implemented, a similar role here, but looking more specifically at Minnesota, over the next 30 years, we're anticipated to gain nearly 330,000 residents. And of that population, the 65 plus group will more than double within that time frame as well. We might see that, healthcare facilities are distributed throughout the state, but are primarily, more lacking in rural areas. We might have less providers because they're, tend to be employed in more urban areas. We might see potentially, fewer services that might be offered in some of the rural areas. And, looking at additional patient populations, specifically in patients that reside in, nursing homes or other long-term care facilities. Over the last 10 years, about half of the nursing homes that closed were in rural communities. So as you can see from the statistics, there's certainly unmet healthcare gaps in these rural communities. And from the map that Cassie started it off with is, we have around 50 pharmacies located in these rural communities that, we're looking for ways to expand our team members to be able to fill this gap. And I'm really excited to be on this journey. Next slide, Cassie. All right, so in conclusion, we're looking to integrate our pharmacy technicians as a community health worker to help improve, overall population health in these rural communities that we're servicing. We want to enhance the, patient support, improve their health outcomes, connect them to resources, address different social determinants of health, and really create, a sustainable model for this role within our pharmacies. So again, thank you all so much for having us here today. I'm happy to open it up to questions or comments, or even if anybody has any reflections about kind of this pilot initiative, we'd love to hear that as well.
Anne, you have a question?
Yeah, actually, it's more of a comment. So I remember talking to you guys, I think it was last summer. I'm so excited and thrilled to kind of see that this is still something that you guys are focusing on and growing and committed to. We're just, oh gosh, I'm just over the moon. I knew you guys would be presenting at some point, but I thought it might be this one. So I was like, I got to show up for this. I'm so excited. So I just wanted to say congratulations and thank you so much for what you're doing in Minnesota for trying to help us explore new models. Obviously, you're doing this work in other states. And so I think as you guys just go along your journey, please let us know at the Alliance. We've got great colleagues, obviously, a lot on this call at the health department and other partners that would all want to see this work be successful. And I love the dual approach. I know we kind of talked a little bit about like you've got an existing, group of folks who are talented and they are trusted in the community, these technicians. And so they're really fitting that how we define, at least at the Alliance, what a community health worker really should be. And then I love, of course, expanding on the workforce in general. So like being able to recruit from an existing pool of CHWs out there, of course, we support that too. So it was just a comment to say congratulations and let us know how we can continue to help.
Thank you so much. I really appreciate hearing those comments and to just being a part of today and seeing all of the resources and individuals involved in community health workers. And so just really excited and appreciate being here.
Any other questions or comments for Samantha or Cassie? I know for me as a community health worker, as with Homestyle Direct, I help lots of folks connect with pharmacy services like delivering their pharmacy meds, asking questions. So Samantha, I've talked with you as well some time back regarding this program. And as Ann mentioned, I'm super excited too. And I knew you guys were close to it though when I talked about it. Congratulations.
Thank you.
Last call for comments or questions for Samantha or Cassie regarding their dual role for CHWs and pharmacy techs. Well,
I think I have a quick question. Do you see this? I know the rural area needs it probably the most, but is there an opportunity for the inner city? I mean, because yeah, it seems to me the way you all have it set up is more personalized. And when you get into commercial, it kind of, the connection kind of trinkles. It gets less and less and less. And so is that an opportunity? Maybe, maybe not. I'm exploring.
Yeah, I can start, and Cassie, if you have anything to add, but I definitely think there's an opportunity there. I think getting started in the communities that we do have such strong ties in was a good place to just kind of get our bearings straight and be able to start up some of the processes that may be able to scale further, and maybe some of the communities that we don't have as much presence in, but may be able to help define the process in a way to bring it to more urban areas. We do have a closed door pharmacy in Maple Grove, Minnesota, where we primarily service long-term care communities, both from a skilled or assisted living or independent living. And there's certainly opportunity there as, different facilities, need assistance in coordinating care, if a patient is discharging back to home or, transitioning between facilities or hospitals, there, is opportunity there too. So I definitely think that would be something that we'd be, looking to expand into over time as well.
And I would just echo your comments, Sam. I've been with Thrifty White for 11 years, and prior to that, I worked in the Twin Cities area with Walgreens, and that frontline worker, getting to see, like, I don't have a fridge to put my insulin in, or I came in and this just happened. There's so much that they see and hear, and potentially without the infrastructure, don't have any way to do something about it. And so I absolutely think that there would be needs and benefits for an urban area. We're primarily rural, but absolutely, I think there's just so much that happens right when someone enters the door of a pharmacy that we could be doing more.
Thank you for that. You kind of got my ears going. Ding, 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 ding.
Just looking at the chat, Kristen Godfrey Walters at MDH says, no questions, just excitement, and wants to thank you so much for sharing background and context. And so if there are no further comments or questions for Thrifty White, thank you so much, Cassie and Sam, for joining us. As with the Homestyle Direct, we will be sharing the slide deck for those who are in attendance today, as well as for those who weren't able to join us. We'll also be sharing, again, the resources that were shared in the chat. I've captured those. I'll send those out right away. As well as to folks who aren't able to attend. We're going to move forward with the agenda now and take a couple of minutes to just do a fast burn. Any successes or challenges and barriers as well that you're seeing with working alongside CHWs, we open up the floor to collaborate and to just speak in that space too.
This is Nicole. I am a CHW supervisor at M Health Fairview. And I think the biggest barrier that my team really kind of sees is how can we better support our patients that are non-English speaking and help them be successful beyond our program? And how can we better do teach back and education for our patients? So I think that's an area that they struggle with.
Anyone in the space here can feel free to respond to Nicole's inquiry. That's a great question.
On the pharmacy side, I guess I can speak that, we do have some interpreter services that, could be used, require getting, essentially how it works is I think they've got 60 or 90 languages, and you call and they connect you to an individual with that language, and then it's a three-way call. There could be some opportunity maybe through a vendor-based solution that could help with expansion of language interpreter services.
Great, thank you. We do luckily have interpreter services within our organization, so it's a really great connection for our team. And we've also thought about using the MDH roster as well for interpreters to empower patients. But I'm not sure if there's other resources and availability as well available to patients that, for long-term success.
Anyone else here on the call have any feedback for Nicole regarding that? I know that we have a few organizations that work with individuals who are who speak English as a second language. So your thoughts and input would be greatly appreciated here.
I think what was just said was really good as far as taking advantage of interpreters if possible, or interpreter lines. With North Point, we're very diverse, so we have interpreters on site that we hire, but there are times when they're busy. We have quite a few, but sometimes it just gets too busy, and so we have to reach out to other resources ourselves. So the lines are always good, and then using those apps when you have to. But for just an ongoing basis, I think the best thing for organization would be try to figure out a resource to have it consistent. far as hiring or using, a vendor to come in or, temp workers or something like that. We find ourselves hiring more, hiring more that actual dual, far as language, because it's very helpful and useful. So, yeah.
And maybe I could add that when it comes to hiring, identifying who the leaders are in the community who are doing this work, probably unpaid, who may come from some of those communities, so that when a position opens up, that you don't use just the traditional ways of posting the job, that you put it out in different languages out in the community. So we did that and were quite successful in getting a very wide, diverse candidate pool, and tapping into some of the leaders in the community that have helped us be able to reach a lot of those communities. But I'm talking more from a county community work, not healthcare setting. I don't know how that would work. And also another thing we are doing is we identified trusted messengers through an RFP process, from most of whom came from our community or closely related to the communities that we serve, that speak from different cultures and languages. And so they've been able to advance or help us advance the work that we're doing with different communities. And then recently, don't know if this relates, but I just want to say it anyway, because of what's been going on with immigration and people fearful of coming out of their homes or whatever, especially undocumented, we were able to have a resource fair in February, and that came as a request from the community, especially through the school districts, people wanting more resources. And so, and we were able to have it. And at first we thought nobody would show up. But we also, within that, included an immigration clinic for people who are facing, different issues. And it turned out to be, and it was in the government building, it was in our county building. So that's another thought. We thought would be a barrier, but no, people came out. And so they were able to give vaccinations for I think we gave out over 60 vaccines, and we're able to sign up people for a week program. So, and it was held after hours, and give, and help them apply for their health insurances and all that. So it became like a working evening, and everybody there. And that really helped reach a lot of people who do not necessarily come in or know where we are. So I just wanted to share that success, and I don't know if you'll draw something from it. Thank you.
I appreciate it. Back as far as your resource, more of them, see a lot, like in our East region, of patients that are going to be experiencing the citizenship area, and I'd love to get that information from you.
It wasn't very clear if you could put it in the chat, or I can put my email actually in the chat. I didn't quite hear what you said.
I'm sorry, it could have been my speaker. I'm just curious if you were holding those fairs still. And if so, could you send that information in the chat?
Yeah, it was just it was our first one to do, and so we're trying to decide if we'll do it again. We're not sure. So I'll give you my email.
I'd also like to open it back up for anyone else to share their successes or barriers they're experiencing working closely with CHW. We have about 6 minutes left. Thank you all for sharing your input with Nicole.
I'm very excited about venturing out on starting I don't want to say a webinar, but I'm bringing together partners that work with elders, and I've brought partnerships, 6 partnerships, and we're coming together to create a cohort where we will be sharing our different expertise. And we'll be coming together for the first time Friday. And I'm really excited because there's just different levels of resources for our seniors. And my hope is to be able for us to work together and collaborate and be able to put our information out on social media and different avenues and places where the families or the seniors can reach out and in one place find this information rather than trying to pinpoint different areas to go. And so we're working on it, and this is just the conversation. And so I'm really excited about that. So as we continue to get it together, and some of the partners are here, and I look forward to sharing more as we bring it together.
Thank you, Peggy. Anyone else? So the next Supervisor Roundtable will be in June of 2025. Keep your eyes open for that agenda as well as the theme topic. Again, I'll share the resources immediately today following this meeting. Thank you, Keisha, for being here. She's going to take off. Thank you, everyone, as well for joining us. Some folks had to drop off. Again, the recording will go out to folks within the next week or so that all of this information can be seen by those who weren't able to join us today. And we thank you so much.